Every day life's happening. Some days are more eventful. Others, living protected with insurance you can depend on changes your life for the better. We insure the people and things you care about. Not Agency. We'll help you find the right coverage so when life happens, you have the right insurance protection for your family and business. When life happens, live protected. Non-agency for all your insurance needs.
Good morning and welcome to Radio Friends on this Tuesday, January the 5th, 2016. We got to get used to saying 2016. Wow. We've got one guest today, Heather Harlan. Good to have you here, Heather.
Good morning. It's great to be here, Paul, as always.
Yeah, Phoenix Health Program.
You
Last
bet.
time you were on, you were telling a story.
Yes.
And we had a lot of comments about that
Well,
story.
that's good. I think I really appreciated your giving me the opportunity.
Yeah.
I'll have a story today to tell today, too, but it'll be a different story.
Right. This is about
Yes.
the Phoenix Health Program. And you told me before we started they're starting a women's treatment center?
Yes, this is really historical. Drum roll, please. Phoenix Health Programs, as many of your listeners and viewers know, our mission is improve the health and quality of life of those affected by drugs and alcohol. And we've served the community in a capacity with residential treatment and outpatient as well, but we're known also as being an option for residential treatment for adult men who need help. But now we're going to open...
Let me stop a minute
yes.
here. But for residential treatment for men,
Right.
for adult men.
Yes.
But you do outpatient for both men and women.
Yes.
But now this is the first time that you will have inpatient for women.
Yes, for residential for
Why?
women. Well, that's a good question because we've served the community already for 40 years doing it this way. There are a couple of really important reasons that we want people to know about. First reason is we want to continue to serve everyone well. And research, Phoenix Health Programs is always looking at the research, what works. And really one of the things we find is for women to do better, to have gender-specific process groups or counseling groups. And so this is a way for us to add to the numbers to have more women involved in treatment at our center so that we can have those process groups that work better. When we say best practices, that means that those are the ways of offering treatment that give better outcomes. So we want to serve everyone well, men and women.
Do you see that there are more problems with men or with women? Obviously men, because that's what you were doing.
Well, that's what we were doing because that was sort of the niche in terms of what we filled. But it's substance abuse disorders are devastating for men and women in terms of career, education, families, and such. So how is it one worse than the other? They're affected differently because there are some different physical makeups in which there might be affected differently. But the first reason is to continue to serve everyone well. The second reason is to offer what we call a social setting detoxification. Now, detoxification isn't treatment. It's a step that's necessary for treatment, but that's where the individual comes out from under the active influence of the drug.
So detoxification is not treatment?
That is correct. It's the first step. It's so a person can get stable enough and feel physically well enough to undergo the rigors of treatment.
So what is detoxification? How do you do that?
Well, that's where the person is with us 24/7, where they're staying at our facility, and they're monitored. And what we have is what we call social detoxification. Right now in Boone County, the only option for a woman who needs detoxification is a hospital setting. It's much more expensive. And what we found over 40 years of being in this business is that social detox, where we monitor their vital signs, we refer them, we have very strict guidelines, we refer them to a hospital setting if necessary. But the vast majority of time, people can detox and come out from under the active influence of the drug safely if we monitor them, we offer encouragement, be sure their electrolytes are up, monitor their heart and breathing rate, etc. And that usually takes maybe 2 or 3 days.
When you enter the detox program, are you taken off that substance entirely, or are you gradually weaned off
Well,
of
usually
it?
they go off the substance, and then it's uncomfortable. That's why you probably don't feel like going to groups or counseling sessions for a few days.
When you enter detox, you're taken off of it
yes.
cold turkey.
Yes. And and again, that's often uncomfortable because the body is, again, if it's a substance use disorder, then there's been a physical dependence, and so it's coming out from under that physical dependence. But we're going to have the detox and treatment available for women in residential beginning. We're going to have our opening with the Chamber of Commerce and the ribbon cutting from 4 to 6 on Monday, February 1st.
Okay. So just about a month from now.
Yeah, and we may even have some beds available in a few weeks. You can call and I'll give you the phone number at the end. So we're really pleased and to be able to offer that so that we can have social setting detox available for women as well as men now.
How long does something like this take? The detox and then the treatment?
It's quite variable. One of the ways Phoenix Health Program is different is we don't have a one-size-fits-all. We look and see what someone needs. Maybe they need a week to get stable. Maybe they need 3 or 4 weeks. It depends on what issues are going on. And we're going to customize it to what they need. But to give an example, again, we have 6 to 8 beds, and a counselor told me a story the other day of someone that he had come in. Again, this is a process, not an event, where she had sexual abuse as a child. Suicidal thoughts were constant for her. Alcohol was a coping mechanism. She could not envision ever having a day not being able to drink. So the counselor worked with her to talk about, would you be willing to try, see if you could go one day? Well, she thought about it for weeks, and then finally they set a date. Okay, that she would try going without alcohol.
For one day?
For one day. And she did it, and then they tried then a few other days, where she began to string together several days at a time.
So she did one day, and then the next day she drank again.
But she tried it, and she realized she could do it. And so they began to build on that success, and she began to do a few days together, and by about the 3rd time, when she really began trying and stringing some days together, she began to reach out and get community support. As she did that, the suicidal thoughts went down. She began to talk with her husband and her adult children, and a whole new life has opened up for her because someone didn't impose on her what she had to do, but listen to what she wanted and help her get there. But it's a process of change, is a process, not an event.
Right.
So that idea of helping people open up to those thoughts and ideas and experimenting and trying those behaviors that they have been perhaps too frightened to try. There's hope.
when you think about substance abuse, if we do not have that particular problem, it is hard to realize what a serious situation it is and how it takes control of your mind.
Yes. Yeah, it is. And what we see is it's a chronic health issue, and I really hope people are listening and pay attention to that. The same way diabetes and asthma and hypertension. So it may take repeat opportunities for people to get help, to get the skill set they need to manage a chronic illness, because the brain is the primary organ affected.
And you have, is it every Monday you have
every
a free,
Monday, thank you. Yep, family and friends group support group from 6 to 8.
If people have any questions, or if they feel they know someone, or perhaps they realize that they need to know.
Phoenix Health Programs, we're on the web, and we're on Facebook, and our phone number is 573-875-8880. And again, our official opening is February 1st, but we'll be for sure booking dates February 2nd and possibly a bit earlier for our Women's Treatment Center. Thank you.
Heather Harlan, thank you so much,
Paul, for
coming back.
continuing the conversation.
Yes, tomorrow, Barbara Buffalo, the city of Columbia. Have yourself a nice afternoon. Bye-bye.